Have peace of mind when it comes to your health and well-being by getting established with a primary care provider. Eric Stanek, Chief Medical Officer at DoctorsNow, is here for today's Hello Health to talk about why this is so important. And we've talked about this before, but I mean, we all need a primary care provider. Why is that so important?
It comes back to the principle of just being proactive when it comes to your health and prioritizing your health on a regular basis, rather than just being reactive and coming to the doctors when you need stuff. We have urgent care clinics at DoctorsNow, and we see people come in through the urgent care who have a bad back injury or bacterial infection, pneumonia, sinus infections, and stuff like that. And we know for a good amount of people that come in, if they had prioritized their health earlier and been established with a primary care doctor, which many people are not, then a lot of this sequelae down the line could have been prevented. A lot of times people who get sick have underlying chronic disease that just hasn't been diagnosed because they haven't been in to get established with a primary care provider. So that's one of many things that we try to provide for people.
Is access to a primary care provider, is that a problem around the country and even here in Iowa?
Yeah, it's a problem in a lot of places. I know a lot of our patients that come in have trouble getting in with their primary care provider, especially when they need something in a more timely fashion, just because a lot of places are at capacity. A lot of primary care docs aren't sticking around at places, so they're cycling through different providers and stuff like that. We're able to get people in same day or next day. We offer primary care at 3 different locations now. I personally work in both our Altoona location and our West Des Moines location. Today's my day off, so it's my time to get to come talk to you. But otherwise, I'm in the clinic seeing patients.
Oh, wow.
So we're able to get people in quickly. We're able to get their medical history, do a full intake, and learn about their allergies, medical history, surgical history, family history. We learn about their social history and what they do for work, what their family life looks like, and then we can start to dive into some questions or concerns that people have. But yeah, access is an issue, and we try to help people out who have difficulty with access.
So if someone's watching this and they don't have a primary care provider, maybe they even do, but they feel healthy, is that the time really to call and make an appointment when you are healthy to establish that?
It's about being more proactive with your health and not reactive. We like to see people when they are healthy, because we want to know what your baseline health is, right? What your baseline metabolism looks like, what your cholesterol, triglycerides, insulin levels, blood sugar, stuff like that looks like, because these numbers change when people are in a state of acute stress. They have an infection, they're sick, they have a cold. So we want to see people when they are healthy and see what those numbers look like, see what people's resting heart rate is, see what people's blood pressure is, and all of that stuff. You have to be in a fairly healthy state for us to get a good understanding of what your baseline looks like.
What are some tests you do for someone who comes in for like a well visit? What are the numbers we should even know? The things we need to know about ourselves.
The thing that we look at for everybody, and you get this at your standard primary care office, is we get a full set of vitals. So we see what your resting heart rate looks like, what your blood pressure looks like. Sometimes these things are artificially elevated when people go to the doctor's office because
the white coat
syndrome. It's the white coat hypertension, the white coat tachycardia. People are like stressed and nervous, and that's not necessarily an abnormal thing. Sometimes it's something that prevents people from coming into the doctors at all. So I encourage people, if they feel that way, you're not alone, it's normal, come in and see us. We're happy to get you established with us. But some of the other tests that we run look at cholesterol, triglycerides, other markers on a lipid panel that give us a good idea of what your heart disease risk looks like. We combine this with people's smoking status, whether or not they have diabetes, high blood sugar, and family history. All of these things go into us being able to accurately assess what your heart disease risk is. And we're also screening for stuff like diabetes, thyroid, anemia, things like that.
And you also have direct primary care, a program where people can, it's basically kind of like a membership. Is that a good explanation?
Yeah, it's a perfect explanation. Yeah, direct primary care is a membership, and it's a subscription that's direct, as the name suggests, between the patient or the patient's family and the medical practice. So there's no middleman, at least when it comes to the payment system. It's a direct relationship between the patient and the doctor's office. And we're able to eliminate insurance, so that insurance is not a requirement for people to come in and get established with a primary care provider and have their annual physical and all of that stuff. If you think about what insurance is, it's something that people elect to opt into for catastrophic, unpredictable events, but having a primary care doctor doesn't really fall under that category. We still see people with all sorts of different insurance plans. We want to be able to meet people where they're at and have options for people to come in and see us. Direct primary care is a really good option for people, and maybe we can dive into that in detail at another time.
Well, thank you so much for sharing this with us. And you can learn more. Just go to DoctorsNow.com or call 515-270-1000. They have locations in Altoona, Johnston, and West Des Moines. And you can see more on social media.